According to official sources on Wednesday, starting the next week, the government is going to make it mandatory for travelers traveling from China and 5 other countries to have negative RT-PCR reports. The next 40 days would be crucial, they added, as January could witness a COVID surge in India. Even if there is a wave, hospitalisation and death rates will be extremely low, according to sources in the health ministry. Filling up Suvidha forms and 72-hour prior RT-PCR testing may be made mandatory starting the following week for international travelers arriving from China, Japan, South Korea, Hong Kong, Thailand and Singapore as the government tightens COVID-19 related guidelines. 39 international passengers were found positive for COVID-19 out of the 6,000 tested on arrival in the last 2 days. As COVID gets back on the radar with a surge in China, people are worrying about another wave in India. The situation in India, where a large number of people have been exposed to the virus and also been vaccinated, is quite different from that in China. The likelihood of a new big COVID-19 wave in India is very low, an expert said. The government has already sounded an alert and asked states and union territories to prepare for an eventuality. Following the surge, the government made random coronavirus testing mandatory for 2% of passengers arriving in each international flight from Saturday. Prime Minister Narendra Modi and Health Minister Mandavia have held meetings to assess the country's preparedness to deal with a fresh surge in cases. Mock drills were held at health facilities across India on Tuesday to check operational readiness to deal with any spurt in COVID-19 infection, with Union Health Minister Mansukh Mandavia saying the country has to remain alert and prepared as cases are rising in the world. The latest spike in the cases is being driven by Omicron subvariant BF7. The official sources said the transmissibility of this BF7 subvariant is very high. A person infected with the subvariant can further infect 16 persons. Satyajit Raj, adjunct faculty at the Indian Institute of Science, Education and Research, IISER, Pune, said there is no reason to expect the Chinese situation, which is specifically shaped by the zero COVID policies that the country implemented for almost 3 years, will predict anything in India. China has been witnessing thousands of cases daily in the last few weeks. On Wednesday, India logged 188 new coronavirus infections with a daily positivity rate of 0.14% and the weekly positivity rate recorded at 0.18%, the Union Health Ministry said. News Desk, Comedy Global.